Hello guys, welcome to our G classroom, and today for the week 5 we are going to discuss the healthcare services. So as we can see in the picture, there are several areas in the hospital and there are many services in a healthcare setting. So these are the areas and systems which we are going to discuss today. So, to start with, the definition of terms. So, what is healthcare services? Healthcare services means the furnishing of medicine, medical or surgical treatment, nursing, hospital service, dental service, optometrical service, complementary health services, or any or all of the enumerated services. So basically, when you say healthcare services, these are the services being given or being rendered to the clients, those clients who are in need of medical services. So medically, surgically, in terms of dental health, so optometrical service, or in an um, eye care needs, so like that, services. So let us review the types of healthcare services. So we have mentioned about primary prevention, secondary prevention, and tertiary prevention. So let's go back to the primary prevention. So primary prevention talks about the health promotion and illness prevention. So we discussed that in primary prevention, the illness or disease doesn't necessarily exist to a client or to an individual. So this focuses on health promotion. On the second one, in secondary prevention, the focus here is the early detection and as well as treatment. That is why it is included there, an early diagnosis and treatment. For the last level, or which is the tertiary prevention, it talks about the rehabilitation and health restoration, especially for the chronic illnesses of our client. Now let's move on to the levels of healthcare or levels of healthcare system. So there are three different levels of healthcare system which are primary, secondary, and tertiary. In this video, you'll get to know more about these healthcare systems as well as different referral systems which are linked or interconnected to one another because the systems or healthcare facilities are interrelated to one another. Next is primary healthcare. So let us define what primary healthcare is. So primary healthcare is the first contact a person has with the health system when they have a health problem. So in other words, when the person is sick, then definitely he would go to a healthcare facility, and that healthcare facility offers or renders primary healthcare to those who are in need of the health services. So usually the first contact between the community members and other levels of the health facility will commence or will start in the primary healthcare. So sometimes when we are sick, we don't usually go directly to the big hospitals. We tend to go to the clinics or health centers. And those are the types of facilities which offer primary health care. And primary health care refers to a broad range of health services provided by medical professionals in the community. So what are the basic services in the community? Let's say a rural health unit or rural health facility, just like our small health center. So they offer medical consultation, they offer treatment, and as well as diagnosis. No? So They offer basically the primary services in a primary healthcare facility, and who renders the care for these clients. So basically, the the persons in charge of taking care of our sick clients are the physicians, public health nurses, rural health midwives, and as well as our BHWs, no? Barangay health workers are also there in a primary care facility. So let us identify the primary healthcare facilities. So we've mentioned rural health units, which are present in barangay or um, in one purok. So that is a possibility, as well as sub-centers or small health centers. So these sub-centers or centers or health centers are actually under the rural health unit. So in other words, RHUs or rural health units are the main branch or main branches of these health centers. So they offer the same and basic services, just like prenatal checkup, immunization, medical consultation, as well as um, family planning. So those are the basic services offered in the RHUs and sub-centers or health centers. The same with puriculture. So puriculture is like an outpatient facility which caters mother and child from postpartum to delivery of the child is being catered to puriculture hospitals or clinics. Then the fourth one, clinics and hospitals. Basically, these are the small hospitals or clinics which are located in our locality. No? They have a lower bed capacity compared to the other facilities, compared to the big hospitals. One example of clinics is a birthing home facility or lying in clinics. So they are under the primary healthcare facility. The next one is the secondary healthcare. When we talk about secondary healthcare, it provides the healthcare is being provided by the medical specialist. Medical specialists such as family medicine physician. So, family medicine physician caters almost all the cases. So, that is actually a specialty. Also, pediatrician, which caters the health problems and health concerns of pediatric clients from infancy to, so let's say, to the adolescent stage. We have also internal medicine, OB/GYN, which caters the mothers, pregnant women, and all cases being handled and all cases related to the reproductive organ of the female. General surgery, emergency rooms, and outpatient departments or outpatient department is also present in secondary healthcare facility. Usually, this facility is being owned by the private sector and the government. So, it's either public or private secondary healthcare facility which offers this kind of healthcare or secondary level of care. And before you go to the secondary healthcare, then the patient is required to go to the primary care professionals. And these primary care professionals should have a referral to the second healthcare facility. In other words, you cannot go directly to secondary healthcare facility unless you were not able to go to the primary healthcare facility or to the health center. Let's say here in General Santos City, we have this emergency hospital. So the emergency hospital is also known as district hospital, and this is a secondary healthcare facility which offers secondary healthcare. So basically, before you go to the emergency hospital, you should go first to the primary healthcare facility, which is your health center within your barangay. Now, there are instances that you will not be catered by the secondary healthcare facility because there is no referral slip being given or being presented to the secondary healthcare facility. So, in other words, we need to carry a referral slip prior to transport or prior to your travel to secondary healthcare facility. And then, so these are the types of facilities which offer secondary healthcare. The first one is infirmaries. So they are small hospitals, municipal hospital, district hospital, and outpatient departments, which also offer secondary healthcare facility. So in this kind of facility or hospital, they are actually more equipped compared to the primary hospital or to the primary facility. They have several stations and units which cater different illness and diseases within this kind of facility. The last one is the tertiary healthcare. So in tertiary healthcare, a specialized consultative healthcare, usually for inpatients and on referral from primary and secondary healthcare for advanced medical investigation and treatment. So basically, in tertiary level of care, you should bring the referral slip or you should undergo the referral system from primary to secondary care facilities prior to forwarding or prior to your transport to tertiary healthcare. So, what are the cares or what are the services being offered in the tertiary healthcare? So, they provide assistance, surgery, and medical treatment for complicated cases and intensive cases or for intensive care. So, they are more specialized compared to the primary and secondary. So, here are the examples of tertiary care services: plastic surgery, burn treatment, cardiac surgery, cancer management, neurosurgery, complex medical and surgical intervention. So in plastic surgery, just like rhinoplasty, any reconstructive surgery, just like also the repair of cleft palate, and cleft lip. So those are kinds of surgery. Burn treatment, if someone suffered from a burn injury, first, second, and third degree. Usually in tertiary healthcare, those severe case of burn is can be catered in this facility. Cardiac surgery, so those surgeries like cardiac surgery cannot be performed in primary and secondary healthcare facilities. So, for example, SPMC in Davao, so they offer these highly invasive procedures for the client. Cancer management, neurosurgery, the surgery in the brain, and as well as complex and medical surgical interventions. Now, in tertiary facility, um, they are highly technological and sophisticated services offered by medical centers and large hospitals. So, in terms of treatment, in terms of surgery, they are more specialized. They have more sophisticated services, and in terms of invasive procedures, they can perform that one. And they are considered to be a larger hospital with big capacity than the first two levels of healthcare facility. So for instance, the tertiary healthcare facilities are as follows: medical centers, just like Southern Philippines Medical Center or SPMC Davao. So they cater um, those complicated cases or illness. Provincial hospitals, regional hospitals, and specialized hospitals. So basically, these are the levels of healthcare as well as levels of healthcare facilities which we could avail depending on our sickness and diseases. So I hope that you learned something today, and I will be giving you an assignment related to our topic today. So that is all for now. Thank you so much for listening. Goodbye and God bless.